Hello, welcome in this lecture on jaundice. Welcome in hematological section of human physiology, and today's topic is jaundice. I am Dr. B.K. Prasad talking about this jaundice. Jaundice is what is jaundice? Jaundice is yellowish discoloration of skin and mucosa, which is due to deposition of excessive amount of bilirubin in human body. This is jaundice. Jaundice is derived from a French word that is jaune, Jaune, meaning yellow, and jaundice is yellow disease. It is also known as icterus. Icterus, that is derived from Greek word ecteros. Look, it was believed that looking at the yellow blood icteria cures jaundice. This is about definition. Jaundice is not a disease in itself. It is a manifestation of multiple diseases, underlying diseases, which involve bilirubin metabolism, liver dysfunction, and about the flow of bile, abdominal flow of bile. This is jaundice. Average level of bilirubin. Average bilirubin level is 0.8 to 1.2 milligram per deciliter of blood. Hyperbilirubinemia is when it is up to 2 milligram per deciliter or more than 2 milligram per deciliter, and jaundice will appear when bilirubin level exceeds 2.5 milligram per deciliter of blood. This is bilirubin. Types of bilirubin. 3 types of bilirubin are present. Unconjugated. Unconjugated bilirubin in large amount in 0.9 milligram per deciliter. Conjugated is 0.3 milligram per deciliter, and delta bilirubin in very small amount it is present. This is types of bilirubin. Now, types of jaundice. Types of jaundice. It is divided into 3 types: pre-hepatic or hemolytic, pre-hepatic or hemolytic, hepatic or hepatocellular, and post-hepatic, that is obstructive. Pre-hepatic, this is before it comes into the liver, and then defect in liver, hepatic, and post-hepatic when it comes out from the liver. 3 types of jaundice is there. So pre-hepatic is also known as hemolytic, hepatic is hepatocellular, and post-hepatic is obstructive type. Conjugated bilirubin is increased in hepatitis, cirrhosis, hepatotoxic drug, and obstruction of the bile duct due to carcinoma or a stone anywhere in the biliary tract. Unconjugated bilirubin is seen in hemolysis, jaundice of newborn, and prolonged fasting and Gilbert syndrome. Unconjugated is increased in hemolysis, jaundice of the newborn, and prolonged fasting, Gilbert syndrome. This now few words about neonatal jaundice. In neonates, physiological jaundice appears from 48 to 72 hours after birth. After birth, 48 to 72 hours, jaundice will appear. This is due to rapid destruction of RBC in infants. Average RBC is 7.8 millions per cubic milliliter of blood, and there is rapid destruction, but enzymes responsible for disposing this hemoglobin is not mature, and therefore enzymes are not mature. Therefore, there is accumulation of this bilirubin, and this will cause unconjugated bilirubinemia. It will resolve in 7 to 10 days. It will resolve in 7 to 10 days when enzymes become mature, and usually it dissolves in 7 to 8 days, but treatment with phototherapy or sunlight may be essential, may help in rapid removal of this bilirubin. Second is pathological jaundice. appears at the time of birth. It is present at the time of birth. It present at the time of birth, and it is due to hemolytic disease of newborns. It is due to hemolytic disease of newborn. It is a somewhat serious condition and needs immediate help and treatment. Incidence of jaundice. Incidence of jaundice is common in males, alcoholic, smokers, drug addicts, and following unhealthy habits, unhealthy lifestyle. Persons who are following non-healthy lifestyle are more prone to develop this jaundice. In developed countries, drugs and obstructions are main causes, and in developing countries, infection with hepatitis A, B, C, or malaria or parasitic infection are more common in developing the jaundice. Pre-hepatic, as I had said, pre-hepatic jaundice is also known as hemolytic jaundice. It or maybe due to congenital defect, for example, Gilbert syndrome. In this case, hemolytic and non-hemolytic, it is conjugated bilirubin is more. Conjugated bilirubin will increase. And second is hepatocellular. Hepatocellular or hepatic may be chronic or acute or chronic. Here, three things may be defective. First is hepatocytes fail to uptake unconjugated bilirubin. Second, hepatocytes fail to transport conjugated bilirubin. This is rate limiting step. Hepatocytes fail to transport conjugated bilirubin into the bile canaliculi. And third is obstruction of the bile canaliculi due to hepatitis. In this case, conjugated and unconjugated both are increased, but more conjugated bilirubin is raised. Third is post-hepatic. Post-hepatic is obstructive or cholestatic jaundice. Post-hepatic is obstructive or cholestatic jaundice. Failure of hepatocytes to initiate bile flow and obstruction in the bile duct, portal tract, hepatic duct, common hepatic duct, and common bile ducts or sphincter of OD. This is post-hepatic, that is also known as obstructive tract. There is obstruction in the flow of this bile. Failure of hepatocyte to initiate bile flow and obstruction in the bile duct, portal tracts, hepatic duct, common bile duct, or a sphincter of OD. Causes of obstructive jaundice are maybe congenital, primary biliary cirrhosis, non-congenital, that is maybe drugs or trauma, chronic pancreatitis, carcinoma, gallbladder, carcinoma anywhere in the bile duct. In this post-hepatic or obstructive case, conjugated bilirubin is raised. Now, what are the signs and symptoms of jaundice? Signs and symptoms: yellow discoloration of skin and mucosa. First it will appear in the eye, and then it will develop. When it develops, then it will appear in the whole body. Lethargy, loss of appetite, weakness, and pain abdomen. Pain abdomen is also present in some cases. Liver may be enlarged, and later stage there may be nausea, vomiting, etc. And these are the signs and symptoms of jaundice. Some signs and symptoms are not specific, but these yellow discoloration of skin or mucosa and irritation and itching. Irritation and itching will appear in later stage. Itching of skin due to deposition of bilirubin in the skin. Now, this is about signs and symptoms. Then diagnosis. How it is diagnosed? History of alcohol, drugs, etc. and Examinations. Examinations are there. Investigations are there. Serum bilirubin level is raised. Urine bilirubin, urobilinogen, liver function test, alkaline phosphatase, ultrasound, MRI, CT, computed tomography, and liver biopsy and cholecystography are needed to establish the investigation and cause of the disease. Serum bilirubin, urine bilirubin, urobilinogen, liver function test, alkaline phosphatase, ultrasound, MRI, computed tomography, liver biopsy and cholecystography will confirm presence of jaundice, and it will also pinpoint the cause of jaundice. What is the underlying cause of jaundice? Prognosis depends upon cause of the jaundice. If it is due to hepatitis, it will resolve rapidly. And if it is due to carcinoma of gallbladder or carcinoma, pancreas, head, etc., then prognosis is bad. Then prevention. What are the prevention? Alcohol, no smoking, no junk food, and protected from infections like hepatitis, improper immunization, ABC, and healthy balanced diet, exercise, and proper care are basic steps to prevent this jaundice. So this is all about jaundice. Thank you. If you like it, then follow, subscribe and like the video. Thank you very much.